Hello, Namaste, Sat Shri Akal. Last week of May is celebrated as International Thyroid Awareness Week. So to get some right information on this very important topic, I have with me Dr. Amarnath, who is a leading expert in this field. Dr. Amarnath is the head of Endocrinology Department at EMC Group of Hospitals, and he has a very impressive track record in the field. He is MBBS and MD in Internal Medicine, MRCP from London and Edinburgh. He has a PG diploma in endocrinology and diabetes from London, and he is also a member of the European Society for Endocrinology, which is a very prestigious society. Hello, Dr. Amar.
Hello.
We all know that thyroid is one of the most important glands in the human body. So please tell us how important really is the thyroid gland for us?
Yeah, as you said, the thyroid important. Yeah, it's a very important gland in our body, and how important is because it controls our metabolism, it controls the growth, and it controls the development, and it literally affects each and every part of all the organs in our body, and with the reproductive system, and very importantly, it controls the temperature in our body.
सर थोड़ा सा एलैबोरेट करके बताइए कि थायराइड हमारी बॉडी में क्या-क्या रोल्स प्ले करता है?
Yeah, definitely I will. So concerned with the metabolism, the thyroid gland produces the T3 and T4. So this T3 and T4, it goes and mainly controls our basal metabolic rate. So what does it mean, the basal metabolic rate? Is how our body utilizes the energy. So this is where the thyroid play a very important role, and then controls our temperature, and it controls the growth in that. And coming to the next, as we discuss about the growth and the development in concern mainly with the childhood, this hormone is very essential for the growth and developmental in the childhood. And going to the, as I said previously about it affects all the organs. For example, heart, yes, it controls the heart rate and the cardiac output. Concerned with the brain, it controls the mood, memory, and concentration. Concerned with the bone, it is the base of the bone mineral metabolisms. And concerned with the hair and it with the nails, so each and everything is controlled by our thyroid hormone. Going to the reproductive, yes, it is very important for the menstrual cycle and for the fertility, and we already discussed about the weight. It regulates our weight.
Wow, that's a lot of important roles that it plays. तो सर आजकल हम बहुत कॉमन इश्यूज भी देख रहे हैं थायराइड के साथ, बहुत लोगों में कंप्लेंट्स हैं. आपकी प्रैक्टिस में कौन सी सबसे कॉमन कंप्लेंट्स लेके आपके पास लोग आते हैं?
Yes, if you want to talk about the most common, usually patients are coming with unexplained tiredness. This is
थकान हो रही है.
Yes, थकावट, बहुत ज़्यादा थकावट. This is the most common complaints what we hear in our chambers. So concerned with the complaints, when it goes to the complaints, we have to divide into two. When the thyroid hormone overactivates, the complaints will be different. When it is underactivated, the complaints will be different.
Okay.
So first I would like to tell about the underactive, means less thyroid function production.
थायराइड कम.
Yes. So thyroid कम में तो क्या-क्या तकलीफ आएगा? The first thing is about constipation, tiredness, period problems, and then concentration, loss of concentration, and then very importantly, they can't tolerate the cold. So this is what we say cold intolerance.
तो मतलब बहुत ठंड लगती है.
So when we discuss about the overactive thyroid,
कि थायराइड बड़ा हुआ. तो
so
फिर
basically क्या होता है? When the thyroid become active, what I said previously about basal metabolic rate, so when it gets increased, immediately they will have fastening of heartbeat, and they will have loss of weight, and they will be very anxious, and they can't tolerate heat. Usually they will have a heat intolerance.
Okay, तो उसमें उनको गर्मी बहुत
है. Just opposite to the underactive, and this is the hyperactive.
सर कई लोग हैं जिनको इनमें से कोई भी कंप्लेंट्स नहीं है. They feel perfectly healthy and they are not seeing any obvious symptoms of thyroid. लेकिन ऐसे लोगों को भी किस टाइम पे कंसिडर करना चाहिए कि एक थायराइड चेक के लिए एक एंडोक्रिनोलॉजिस्ट के पास जाएं? What is the advised time or the right age, if any, as such, to see an endocrinologist for a thyroid check?
That's a very interesting question, because usually people go to the doctor when they have complaints, but these are the hormonal imbalances which will take more time to have a proper complaint. So it's always better to get checked before the complaint comes in. So first and foremost, I would like to tell about the American Thyroid Association. They have kept a age, the female, more than 35 years. they have to check the thyroid function test every 5 years, even though there are complaints or not. That's the first thing.
Right.
And second thing, when they are planning for pregnancy and when they are already pregnant, they have to check the thyroid function test. And when there are the strong family history of thyroid disorders, they have to get checked.
Right.
And there are any not known cause for the neck swelling, it has to be checked.
Thank you so much for this very important information, and for exactly this reason Dr. Amarnath has agreed to do a special evening thyroid clinic or an endocrinology clinic at EMC Cradle. तो 29th और 30th May को Thursday और Friday इस week डॉक्टर अमरनाथ अवेलेबल रहेंगे EMC Cradle में शाम को 4:30 से 5:30. तो किन्हीं लोगों को अमृतसर में या हमारे इस एरिया में थायराइड से रिलेटेड या डायबिटीज़ से रिलेटेड या एंडोक्रिनोलॉजी से रिलेटेड कोई भी हार्मोनल इश्यूज़ फेस कर रहे हैं तो डॉक्टर अमरनाथ को EMC Cradle में 4:30 से 5:30 आके मिल सकते हैं. थैंक यू सो मच.
थैंक यू.